there's a certain point that medicine can treat. That's true. We know this. But then there's a certain point where, as a physician, I need to point out where cultural things or lifestyle things are impacting your health and causing a medical condition. So there's an overlay with lifestyle always in medicine. We know that. And I step into that space with my patients all the time in a preventative, tone. That's my job, is to be preventative with them. And so I discuss these things. So, when I was talking about men dealing with their significant other in terms of PMS, I started talking about silencing the self, which is something that women do. Silencing the self has been with me in my practice since I first opened the door. I didn't always know she was in the room with me. She's been there the whole time. Women have been with me all of these years, and I haven't always addressed it by name because I didn't always know it by name. I had to get to know her over time and what this is. But when you have a patient presenting to your clinic, with cortisol irregularities and with, a host of other biological symptoms, you have to be a good doctor and take a good history. And like good history means like, what's their social history? What's their support systems? What's their life like? All these years practicing, it's difficult because you'll have a patient come in and she'll just say, I'm fine. I'm not stressed. I can keep going. There's nothing wrong with me. Meanwhile, her cortisol is very low. Blood sugar can be low. Insulin is high. And she's gaining weight. I use this example a lot because it's an easy one to point out. But also you have patients with hypertension, infertility. It's not monolithic to just weight. And the thing about self-silencing is it's like you're trained to think that that's normal since you were little. And silencing the self has become such a normal part of our culture and just accepted. It's like men don't cry, we know there are a lot of unhealthy things put out there for us, and we just accept them and we think they're normal. And if anyone steps away from that, you're punished culturally. Like, if a guy were dare to cry, he's no longer really a man. There's a lot of foolishness. And I would say that silencing the self is one of them.